and also the opportunity to come back to Murcia that I visited many years ago. I am the Cardiovascular Epidemiology and Prevention Department Director. I would like to present 2 slides about Tunisia. Tunisia lived multiple transitions, a demographic transition thanks to the program of family planning implemented early in the 70s. We lived also a social and cultural transition, an epidemiological transition, and political transition, which profound transformation initiated in the region thanks to the well-known Arab Spring. The population of Tunisia is about 11 million, and the urbanization about 66%. The GDP is per capita in PPP is about 9,000, and the total health expenditure is about 5%. Fertility rate is about 2, and life expectancy at birth is about 73 for men and 77 for women. The major concern in Tunisia now the economic development inside and outside the health sector were intensifying both urban and rural inequalities and coast and interior inequalities and inside whose importance became actually apparent as mounting public anger about healthcare deficiencies proved to be one ingredient in the revolution. So the problem of the health sector was one reason of the revolution. The research on health in Tunisia, there is a consensus that research is a priority. And now Tunisia, we are writing the new constitutions, and many researchers advocate to integrate a specific article in the new constitution about the research. However, the research expenditure is a small rate of the GDP, about 1% of the GDP, and it's decreasing, and now it's about 0.5% after the revolution. The research on health, Ministry of Health, Education and Scientific Research is the key strategic institution overseeing the planning of the bulk of the research. Specialized agency as the National Agency of Research Promotion and the National Committee of Research Activity Evaluation had the Ministry of Education. Within the Ministry of Health, the general direction is devoted to the research, and many units and laboratories were created. There are a couple of institutes and departments devoted to the research. The main, I don't speak about the university, but the research programs. The main topics are about biology and molecular biology, cardiovascular disease, epidemiology, prevention and management, cancer, epidemiology, prevention and management, genetics, and diverse laboratory and unit. But I would like to say that there are many small units, and they don't do well in the research. They are there, but they don't do well in the research. You asked us to speak about the quality of life related to health. Tahina project, I will speak about Tahina project that I coordinated. the quality of health was investigated related to social determinants of health. Some studies conducted on specific disease like asthma, depression, studies on quality of life related to social problems like violence against women, and studies on quality of life related to behavior, for example, physical activities and quality of life. All the laboratories and research units are located at the eastern coast. In the interior, there is no research laboratory or unit. And this is the difference between the east and the west. The east, which is rich, and the west, which is poor region. The international cooperation on the health, on research on health, there is the bilateral cooperation, especially with France, INSERM, and IRD, Institut de Recherche pour le Développement, with Maghreb countries and Arab countries, Spain, Italy, and there are new partners like India, China, Japan, and United States. For the multilateral cooperation, especially FP6 and FP7. There are many countries, we have many projects with some with countries from the region. I have some slides about our laboratory. It's the Cardiovascular Epidemiology and Prevention Laboratory, CARIPLA. It was created on 2000 according to the resolution of the National Consensus on Cardiovascular Disease Strategy. The axis of the research is epidemiology, about mortality, morbidity, risk factors, social determinant of cardiovascular disease, prevention, to implement best buys on cardiovascular disease prevention and control, and economic as evaluation of the cost of the management and effectiveness of interventions. I will present three projects funded by EU. The first one is the epidemiological transition and health impact in North Africa. I was the scientific coordinator, and the administrative coordinator was from Institut de Recherche pour le Développement from Montpellier, France. The main results of TAINA project is in the region, especially in Tunisia and Algeria, because Algeria and Tunisia were involved in this project. Societies are facing profound and complex changes affecting lifestyles, food consumption, behaviors, and transmission rules. The main trend identified are the reduction in the time devoted to food in all its aspects, the disappearance of solidarity and commensality, the standardization of food and diet under the influence of industrialization, technological development, and globalization. Northern African countries are experiencing fast advancing epidemiological transition. Non-communicable diseases, particularly cardiovascular disease, are increasing dramatically. This transition has clear economical implications for the health sector due to the ever-rising cost of treatment. Health services in the region developed to tackle acute infectious disease, maternal and perinatal disease, are facing new challenges to promote effective care and prevention for non-communicable disease, and there are still no signs of success in halting the cardiovascular epidemic. The population is not really involved yet in promotion of its own health through healthy lifestyle and behavior change. Some results about the quality of life and the score of perceived health status, and there is a difference between men and women, and the epidemiologic transition affected more women than men. Cardiovascular disease are increasing more on women than on men. And you see the score of physical health and psychological health is different from between men and women. The project 2 is the Mediterranean studies of cardiovascular disease and hyperglycemia, analytical modeling of population, socio-economic transition. It's a FP7 project, and it was coordinated by Newcastle, and I was the Tunisian coordinator. The partners are University of Newcastle, University of Liverpool, St. George Hospital of London, and from our region there was Syria, Palestine, and Tunisia. The results is we have the modeling of cardiovascular disease, diabetes, and stroke. We have also health system challenges of NCDs in the 4 Mediterranean countries, and we also promote the use of evidence to support the development of healthy public policy. And we have also recommendations about the policy initiative both within and outside the health sector, likely to be the most effective and the cost-effective in reducing the burden of cardiovascular disease and diabetes, SAT reduction, and beyond SAT reduction. Donc these are the results of MedChamps. The project 3 is non-communicable disease and their social determinant in the Mediterranean, building sustainable research capacity for effective policy interventions. It's RiskApnet. We have the same partners, but we at Jordan and University, American University of Beirut. So we have Liverpool, Newcastle, Syria, and we have also 2 other countries from the region. And this project is ongoing, and we are focusing on social determinant of non-communicable disease. This project is focused on capacity building. The lessons from the 3 projects. The project were a very good opportunity for the capacity building for Tunisia, especially for training, fellowship, publication, masters, and PhD. We have also good fund for fields activity. The challenge, as I said, there are many small units, research units in Tunisia, and there is no coordination. And we would like to enhance the coordination in our region, in Tunisia, and also in our region. And we would like, and I would like to discuss with you how to integrate Algeria and Morocco, especially Algeria. It's a big country, it's a huge population, but it's not integrated in the European projects. The multi-sectoral approach, yet we don't have a good multi-sectoral approach of health. There is an economic crisis, and we don't know what is the future in this region. Especially, we have the political transition, which is a big issue for Tunisia and also for Egypt. And I thank you for your attention.